Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is AQILAH DIYANA binti SAPOWAN, and today I will be giving a descriptive speech with the title of Art as a Form of Therapy. Have you ever experienced something so deeply that you couldn't figure out how to explain it through words, not even to yourself, your friends, your family, or even your therapist? All of us may have experienced these certain moments in our lives with stress, sadness, or fear that can sit quietly in our minds with no clear way of expressing them. Once these emotions are not expressed properly, it will accumulate to the point of having an emotional breakdown from years of suppressing. Today, I am speaking about this issue as someone who has also experienced it, not to tell how bad it was, but how it can be overcome by a few efforts. This is where art therapy comes into play. Art therapy provides a safe and creative way to communicate those feelings without needing to speak. It is not about producing an artwork that reaches a certain standard to society. However, it is about using shapes and colors as a way to understand our emotions. Thus, I will explain what art therapy truly is and the history behind it, including how it works as a form of emotional healing that can be beneficial to everyone. Firstly, what is art therapy and its history? According to the American Art Therapy Association, art therapy is a mental health profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and human experience within a psychotherapeutic relationship. In other words, art therapy is a creative and therapeutic approach where we use artistic methods such as drawing, painting, or collage to treat psychological disorders and enhance our mental health by understanding our thoughts, emotions, and experience. This is done under the guidance of an experienced art therapist. Most art therapy practitioners would agree with Eleanor Ullman's theory, where anything that is called art therapy must be genuine to both art and therapy. Historically speaking, art therapy began to develop as a professional practice during the 1940s as psychologists started to recognize the therapeutic value of creative expression. One of them being the mother of art therapy in America, Margaret Numberg, whose idea is art as a form of symbolic speech combined with Freudian psychoanalytical theories, meaning the unconscious thoughts and emotions are presented through images and symbolism. Her theory focuses on the process of creating the artwork rather than the artwork itself. Meanwhile, another key figure of art therapy, named Edith Kramer, focuses on the artwork itself and its offers of potential healing. This feeling can be seen in the aftermath of finishing an artwork, like being relieved or happy or mad or sad when the artwork is done. Next, we must examine the psychological benefits of art therapy. Key psychological benefits of art therapy include reducing depression symptoms, elevating anxiety and stress, as well as the ability to process trauma and PTSD. First, we have reducing depression symptoms. Patients with depression improves significantly more than those in standard care through drawing in art therapy sessions. These sessions provide a safe space for patients to vent about painful feelings that can be rekindled into positive ones, as it helps patients to reduce their symptoms. As an example, patients make drawings with themes of conflict between families, health, or retirement to express their worries through art making rather than self-harm. Next, alleviating anxiety and stress. Overactive minds of anxiety disorders patients may soothe through art-related activities such as drawing a stress relief kit with items that patients would utilize for self-soothing. This activity uses oil pastels and markers on drawing paper. This helps patients in strengthening their ability to regulate their own emotions by exploring methods for stress reduction and make them feel less anxious. Other than that, there is the ability to process trauma and PTSD. Some war veterans who face PTSD, grieving the loss of their loved ones, and survivor's guilt get the chance to externalize and confront their traumatic experiences through creating images. This can be seen in an art activity called Aging through Collage, in which patients are asked to represent what aging means to them using phrases and images of magazines. For example, a patient created an artwork within the statement of nobody to share with. After relentless trauma from prison camp, the death of his wife and colleagues in the war. This way, it helps patients to accept changes after identifying them in a gentler way and over time diminishing their nightmares and flashbacks of the war. In conclusion, we now have learned that art therapy is more than just an art class. Art therapy combines psychoanalytical theories and symbolism in art to treat real mental health conditions from anxiety to trauma. The goal is clearly not to make a pretty picture. Instead, it is to solve problems with creativity. Whether it is for a child or an adult, art therapy provides a voice without words as it reminds us that healing doesn't always have to be spoken. It just needs to be seen. Thank you.